Wow, have you heard this? In India, snake bites, they cause a staggering number of deaths and disabilities, too. It's a serious public health crisis, one that's flown under the radar for too long. But thankfully, the Indian government's taking action. They've got this really ambitious initiative going on, and we're going to dive deep into it today. So we've got this letter straight from the Ministry of Health and Family Welfare, and it outlines their plan to make snake bite a notifiable disease
What?
officially. We're going to unpack all of that, figure out what it means, why it's such a big deal, and what kind of impact it could have potentially down the road.
Okay, so this letter, it jumps right into the thick of things. It labels snake bites as a major threat, a very real threat. It can even be fatal. And they highlight that certain groups, they face a much higher risk than others. Farmers, for example, and tribal populations. Why might that be? What factors are at play here?
Yeah, it boils down to their environment and the work they do, right? Think about it. Farmers and people in those communities, they're constantly around snakes, just by the nature of their lives and their work.
Yeah.
That exposure, it just puts them at a much higher risk.
That makes a lot of sense. It really shows how interconnected our health is with where we live and what we do. And that's precisely the issue that India's National Action Plan is trying to tackle. It's called NAPSE for short. And one of their big goals, their ambitious goals, I should say, is to cut snake bite deaths in half by 2030. Now, the letter that we're looking at today, it really stresses how important surveillance is. It's all about gathering data, kind of like a detective meticulously piecing together clues to crack a case. So how does this detective work? How does it translate to public health, would you say?
It's a spot-on analogy. I like that. By tracking snakebite cases carefully, we can pinpoint those high-risk areas, those hotspots. We can understand why some people unfortunately don't make it, why they don't survive, and we can see if our strategies to prevent snake bites, if they're actually working or not. That data, it's gold. It's the key to solving this public health puzzle, so to speak.
Right. So to build this robust database, India is making snakebite a notifiable disease officially. And that means every single health facility, every hospital, clinic, both public and private, they're all required to report every snakebite case. And they have to use this standardized format. That's a huge step, don't you think? It's like flipping a switch. We'll suddenly get this much clearer picture of how big this problem really is.
Oh, absolutely. It's a game changer for sure, including private hospitals. That's key. It's going to massively boost our data collection efforts. And then we'll finally have an accurate grasp of how widespread snake bites really are across India. And that standardized format is like having everyone speak the same language, data-wise. Researchers, they'll have this consistent, reliable data to work with.
And to give you a sense of just how detailed this is, this format captures it all. The date and time of the bite, the location, of course, the circumstances surrounding the bite, what kind of first aid was given, and if they know it, even the type of snake involved. It's really painting a full picture. So with all this data pouring in, what kind of insights could researchers uncover? What's the potential here?
Just imagine having all of this information, all neatly organized. Researchers could see patterns emerge, they could pinpoint hotspots, almost like a heat map of snakebite incidents across the entire country. It's incredible. For example, let's say they're looking at the circumstances of each bite. They might discover, hey, most bites happen when people are working in fields or maybe walking through tall grass. That's valuable stuff. And that kind of intel, it could totally shape how they design prevention campaigns, make them super targeted and effective. It's all connected.
You're right. It's not just numbers on a page. It's about turning those numbers into insights, actionable insights. And it makes me think of another important data point they collect. What kind of first aid was given before someone even reached a hospital? Why is that so important? Why track that?
It's crucial. It tells us, was the first aid helpful? Did it actually do any good? Or did it maybe make things worse, unintentionally? This data, it can help us train healthcare providers better and even educate the public. Make sure everyone knows what to do, the right way to respond if someone gets bitten. It can literally save lives.
That's a great point. It shows how data can drive real change, not just theoretical stuff. It can impact public education campaigns, first aid training, everything. And it all stems from making snakebite a notifiable disease.
It really shows the power of data, how it can fuel real change and lead to better outcomes for snakebite victims. It's a powerful thing.
It's amazing to see how this initiative is attacking the problem from all sides. And speaking of different angles, let's take a closer look at the letter itself. It's actually addressed to all the health officials, every state and territory in India. And it's not just a suggestion to make snakebite notifiable, it's a direct order. They have to do it. They're serious about this, right? It's not optional.
What's really interesting is that top-down approach. It's coming straight from the top. They're making it clear. This is a national priority. No ifs, ands, or buts. The letter even lays out the steps for implementation. It tells the states, look, either use your existing public health laws, or if you need to, create new legislation. They want to make sure reporting is mandatory, no loopholes.
They're not messing around. They're leaving nothing to chance. And to help things run smoothly, they even provide a contact person at the National Center for Disease Control, the NCDC. Anyone who needs help implementing the system, they can reach out for guidance. It's like they're saying, look, we're here to support you every step of the way. What do you think about that level of commitment, that they're providing that kind of support?
It's definitely encouraging to see that level of coordination and support, that's for sure. Rolling out a system like this across a country as massive and diverse as India, it's a huge undertaking. You need that support structure in place. It makes you feel like they're truly invested in making this initiative work.
This leads us to another crucial thing the letter highlights: training healthcare providers. They need to be properly equipped to handle snake bites, diagnose them correctly, and treat them effectively. They can get pretty complex, right?
Absolutely. If at all possible, it's crucial to identify the snake species accurately. That's essential for choosing the right antivenom. By the way, just a quick reminder, antivenom is a medicine made from snake venom, and it's specifically designed to counteract the venom's effects.
It's good to clarify that not everyone might be familiar with how antivenom works, right?
Exactly. And beyond identifying the snake, healthcare workers, they need to be able to tell the difference between venomous and non-venomous bites. Avoid giving antivenom when it's not needed, and then manage any complications that might arise. Proper training, it's the cornerstone of making sure patients get the best possible outcome.
It makes perfect sense. Giving antivenom when it's not necessary, it can actually do more harm than good sometimes. And speaking of antivenom, the letter stresses the importance of having a reliable supply and a good distribution network. They want to guarantee that anyone who needs this life-saving treatment can get it no matter where they are.
Access to antivenom, it's absolutely critical, no question, especially in remote areas where getting to a hospital might take a long time. If you have trained community health workers who can administer antivenom right there on the spot, that could make all the difference. It could be life or death, literally. It has the potential to drastically reduce those mortality rates in those hard-to-reach areas.
That's a really important point. How do we bridge that gap? How do we get those essential medical resources to the communities that need them the most? The letter seems to suggest that community engagement, that's a key piece of the puzzle. It really emphasizes educating the public, teaching them about snakebite prevention and first aid.
Empowering communities with knowledge, that's essential. Teaching people about snake behavior, how to stay safe, promoting simple things like wearing protective footwear, especially in those high-risk areas, knowing what to do if you get bitten, and maybe even more important, knowing what not to do. We can significantly lower the number of incidents just by doing that. It's about being proactive, not just reactive, you see.
It's about taking that information and putting it into action. Not just for healthcare professionals, but for everyone. Individuals, communities, everyone has a role to play. Knowledge really is power, especially when it comes to something like snake bites. One thing I found really interesting in the letter was the focus on research. They're pushing for more studies, trying to understand snakebite epidemiology better, how effective different treatments are, and even developing new and improved antivenoms. They're thinking long term, that's for sure.
That focus on research is so important. If we want to keep getting better, we need to gather more data, analyze trends, learn from what's worked and what hasn't. That's how we refine our strategies, develop better treatments, and ultimately take better care of people who've been bitten. It's a dedication to constantly improving, acknowledging that we always have more to learn.
It's a perfect example of how scientific progress goes hand in hand with these public health initiatives.
Exactly. It's a symbiotic relationship. And this commitment to research, it shows that the Indian government is in it for the long haul. This isn't a quick fix. It's a comprehensive, multifaceted strategy to create a lasting impact.
So let's zoom out for a second and look at the big picture. What does all this tell us? It's clear that India is taking snake bites very seriously. They're putting resources into surveillance, training, making sure people have access to treatment, educating communities, and pushing for more research. It's a holistic approach, and it seems like they've got all the right pieces in place. So what kind of impact, what kind of difference do you think this could make?
This initiative, it has the potential to be truly transformative. It could dramatically reduce the number of deaths and disabilities caused by snake bites in India, improving countless lives. And it could even be a model for other countries dealing with this same issue. sharing the lessons learned, the best practices, so others can adapt and implement similar strategies.
It's a great example of how a data-driven approach, tackling the problem from all angles, can really make a difference when it comes to a complex public health challenge like this. And for anyone interested in global health, this is definitely something to keep an eye on.
Yeah, it really highlights the power of working together.
Yeah.
Innovation, assured commitment to saving lives. It's all there. It shows that even when we face these massive challenges, these seemingly impossible situations, we can make progress if we bring the right things together. Knowledge, resources, and that drive to actually make a difference.
It's inspiring, honestly, seeing such a well-planned and proactive approach to this issue, an issue that often gets overlooked. And it all comes back to that central message. Data is power. India's tracking these snakebite cases so meticulously, it's going to help them identify trends, figure out what works and what doesn't, and ultimately save lives. That's the goal.
Yeah, it's a textbook example of how information can lead to action, real action on the ground. And that action, it can take so many forms. Better training for healthcare workers, those on the front lines, more effective public awareness campaigns that reach everyone, improving access to antivenom so it's available when and where it's needed, and even focusing research efforts where they'll have the biggest impact. It's all connected.
Absolutely. It's about recognizing that a problem as complex as snakebite, it needs a multi-pronged approach. You got to tackle it from all angles, and that's exactly what they're doing. Now, I know what some people might be thinking, this is all great, but what can I do about it? I'm just one person.
It's a good question, and it brings up a really crucial point. These government initiatives are vital, absolutely essential. But individual actions, what people do in their own communities, that matters too. It's two sides of the same coin, really.
So where do we start? If someone wants to get involved, what's the first step?
Well, a good place to begin is right where you are. Learn about the snakebite risks in your own area, the types of snakes, the preventive measures you can take, especially if you live in a place where snakebites are common, or if you travel to those areas. Familiarize yourself with venomous snakes, know how to avoid them, and what to do if, God forbid, you get bitten. That knowledge can make you feel more confident and prepared.
It can be life-saving, literally.
Exactly. And don't underestimate the power of simply spreading awareness. Talk to your family, your friends, your neighbors. Sharing this information can have a huge ripple effect. It creates a culture of prevention, a community that's informed and prepared. We can all be advocates for snakebite awareness.
Absolutely. It's a reminder that even small actions can make a difference when it comes to a global issue like this.
For sure. And if you want to do even more, there are lots of organizations doing amazing work in this area. Groups focused on snakebite research, education, treatment access. They rely on the support of individuals to make a difference. Even a small donation can go a long way.
So as we wrap up our deep dive today, I want to leave you with a question to think about. We've seen the devastating impact of snake bites, and we've learned about how a data-driven, collaborative approach can combat them. What role do you see yourself playing in this global effort?
It's something worth reflecting on. Every action, no matter how big or small, it contributes to the solution.
And as always, we encourage you to keep learning, keep exploring. There's so much information out there and so many people working to address this challenge. So thanks for joining us today on this deep dive into snakebite surveillance in India. It's been a fascinating journey, and hopefully you've learned something new and valuable along the way. Until next time.